Hello and welcome. This is Oscar here, the Simple Surgeon. Today I will talk about how to read the medical research. Thank you very much for watching this video, and thank you, Szymon, for asking this question. Szymon is a non-medical person who wants to read medical research for his business purposes, and he is asking me how to read it. And it is an interesting question. I think it deserves a separate video, so here it goes. First things first, there is a gazillion journals printing medical and non-medical research. Point number one, when you want to study the results of the research, pick a journal or pick several journals in your own discipline, in your own branch, that reflect what's on the market best. How to do it? Simply ask your friends, ask your peers, ask your colleagues, ask whoever is reading journals. They will tell you what's good and what's bad. So number one, pick a journal. Number two, scan through abstracts. Abstracts or short summaries of research are often available free online, and it's easy to look through them or search for them online using search engines. But abstracts or the shortened version are not enough to make any conclusions. Reading an abstract is not enough for you to make any conclusion and base your actions on that. So don't use abstracts only for any decisions, whether it be business decisions or clinical decisions. So number three, it's obvious. When you have scanned through the abstracts and found something interesting for you, get the full text. Get the full text. It's not easy. Often you will be asked to pay money to access the full text. There are ways of getting full text from medical libraries or getting yourself affiliated with a university will get you free access to a number of journals. Or if it is required for you to read medical research by your employer, they also can get you or buy you access to full text of certain journals or just single articles that you pick. And once you have a full text in front of you, I would recommend that you read it in the opposite order than you would write it. When you write a medical report, when you write a medical paper, you start with the results. That's at least my school. I was taught that. You start with results and then add others. So introduction comes at the very last. The conclusions come last. The methods are in the middle somewhere. You start with results. But when you read an article, finish with results. Don't start with the results. Start with introductions and discussion. Why? Because the authors have done the job for you, and often a lot of other research already checked, already read through as full text, and its conclusions are available in the introduction and the discussion sessions. You can get loads of information without searching the web yourself, without trying to get full text of the other research papers, just by reading introductions and discussions of a well-constructed medical paper that you got. Introduction and discussion. The next section to read through carefully is methods. If you are in that discipline, if you are an expert in that field, you will immediately recognize if there is something wrong with the methods. If you agree with the methods, you may agree with the conclusions of the paper. But if you don't agree with the methods, don't agree with the conclusions. They may be the same as you think, but they cannot be based on that research if the methods are not correct. And this is the most vulnerable point of every paper. Poorly constructed experiment and poorly explained methods, or the methods that just won't work for this purpose. And after that, go to the results section. And the most important part, obviously you need to check if the results have all the data necessary, if all the positive and negative results have been mentioned. Do they have the p-value, that level of confidence at 95% that is arbitrarily, remember, it's arbitrarily set for medical sciences. But don't throw away the results that have not passed the p-value test, and don't believe blindly everything that has passed it. It's just the statistics. But back to the essence. The essence of the results for you as a reader of a medical paper is, do the results shown justify the conclusions? You are an intelligent person. You don't have to believe everything you see, and you don't have to have the same thought process as the researcher. That goes two ways. One, you can decide that the result of the research does not justify the conclusions. Remember the example of appendicitis treated with antibiotics. People used to say that after 2 years of treating appendicitis like this, they conclude that it's a safe method. They have no clue whether it's a safe method or not. It's short-term safe as far as they can say, but long-term nobody knows. Therefore, this conclusion was not justified by the results of the research. And it actually came up in the method section. But there is another point to that. When you read the results, you can make your own conclusions that the researchers did not spot. There is actually an instrument in the medical research, which is called letter to editor, when you can raise those issues of conclusions that were not mentioned but are resulting and are justified by the results presented in the paper. You can write a letter like this, send it to the editor, and then the authors of the research will be asked to reply whether they agree or don't agree. These are very interesting discussions because they go down to the point they're taking apart the research, checking it for faults, but checking it for strong points as well. Results must justify conclusions, or you make the conclusions yourself. At this point, I think it is necessary to introduce the levels of confidence, the levels of evidence, and the power of certain research papers. In the evidence-based medicine, because that's what we're talking about now, different types of research experiments or different types of research papers have different power. And at the moment, it may change with time, at the moment, the highest power is the systematic review or meta-analysis of several well-constructed randomized controlled trials. Meta-analysis means that you have access to the basic data, dragging out every case of each of those randomized controlled trials and putting it en masse all together through the analysis process again and seeing if the results are the same as each and every of randomized controlled trials or RCTs suggest. This is the highest power paper at present. Well, the second highest would be randomized controlled trial itself. So double-blind, random assignment to this group and the other, and the statistical analysis. The third level, which is actually 2A, would be systematic review, so taking several cohort studies, which are retrospective studies most of the time, retrospective cohort studies, taking several of them and analyzing them, and its subdivision, a single well-constructed cohort study, will be next in the ladder. Going down, we have a systematic review and a single case of a case control study. And then there's a case series, and then there's case reports, and the lowest power is an expert opinion. This is all good for common and popular conditions, but it is not so good for those less common. Simply there aren't enough cases of certain conditions, certain diseases, to make a controlled trial of them. In some cases there aren't even enough cases to put them through the statistical machines. And in those instances, we will need to base our decisions on case reports or cohort studies or case series or even expert opinions. So don't throw them away just because they are low in the power ladder. Despite certain research where the expert opinion, case study, case series is low in the ladder, it may be highest available evidence. All you need to do is keep in mind it is less powerful evidence and be extra vigilant when making decisions based on this research. On the basis of power of available research, every guideline will have a little letter beside which will tell how strong it is recommended. If you read guidelines nowadays, you should, beside each sentence really, have a letter stating how strong evidence is behind that statement. Level A will be based on very strong evidence, meaning meta-analysis, randomized controlled trials. And the recommendation will be strong, meaning you may be a fool if you go against it. Keeping in mind, we are only talking about 95% of confidence. Level B, a recommendation without the word strong, based on well-constructed cohort studies or poorly constructed randomized controlled trials. Levels C and D will be based on case control studies and case series and sometimes expert opinions. And they will not be called guidelines or recommendations. They will be called options. You will need to choose whether to use it or not use it. What more, you should say to the patient whether what you're doing is based on strong research or based on weak opinion. Keeping in mind that opinion might be all that you've got in the literature. That summarizes this topic, how to read medical research. I will put in the description below, I will also put some references with visual representation of those levels of research, level of power of research papers, and level of evidence behind a guideline for all of you that prefer to look at the table rather than listen to my voice, which is most of the population. So I'll finish for now. You look through the tables. Thank you very much. Bye bye.